Hello everyone, I am Dr. Vibhor Borkar. I am a pediatric gastroenterologist, hepatologist and liver transplant physician practicing in Mumbai and Western India. We often find that kids do complain about tummy pain quite often. So how do you know that it is just a simple infection which lasts for a short time, or it's something chronic or something which keeps on coming and hurting the child's tummy like IBS or irritable bowel syndrome? Let's dissect out this step by step. Now let's see what is IBS. IBS means irritable bowel syndrome, which is a chronic and recurring pattern of a tummy ache where it is very non-specific and there is no particular cause for it. It is generally triggered by many aspects, like it can be triggered because of food, stress, meal, or even sometimes infection can also trigger it. Against this, infection is something which starts suddenly, lasts for a specific time and then settles. You can get repeated infections also. So let's see how to differentiate between these two conditions. Now in irritable bowel syndrome, generally there is a tummy pain which can come at any time of the day. Most of the time they are during the daytime and not in the night time. So it can be associated with bloating, sometimes diarrhea, constipation, sometimes all these things keep together, and it can be very non-specific. However, in infections, it starts suddenly. There is a significant loose stool, can be associated with the vomiting, tummy pain, child may eat little bit less, and generally after a few days it settles. It may settle with treatment or sometimes without treatment also. Now, when we should be worried about, or when it cannot be IBS or something else, because if you see the symptoms are overlapping, they are quite similar, and for a general person it may be difficult to differentiate between the two. So whenever you have doubt or this condition, definitely you should refer a doctor and avoid a self-diagnosis. It's very important. When we should be worried about it is if along with this loose stool or diarrhea, constipation, you are having the blood in the stool, significant mucus, vomiting is significant, there is a weight loss. Because of this, child is getting up in the night complaining about pain, child is getting up in the night and passing the stool. These are the red flag signs where probably it may not be irritable bowel syndrome and maybe something else. Whenever you have infection, do see a doctor, don't self-medicate. It's very important, because infection can be sometimes because of viruses, can be parasites or bacteria. When there is generally a bacterial infection, there you can see a visible blood in the stool. If it is there, then your doctor or child specialist can ask to give antibiotics. However, all diarrhea do not require antibiotics. Similarly, when there is an irritable bowel syndrome, you don't need antibiotics at all. That's why correct diagnosis is very important. Giving unnecessary antibiotics do also damage a friendly bacteria, and the balance between the good bacteria in the gut can get disturbed and the child can have n number of symptoms. Also, it's prone to have a repeated infection, so avoid unnecessary antibiotic use. What precautions to be taken for infection? Most important is to have a healthy and hygienic food, hygienic water. If you are eating outside, you should be sure that you are eating from a good places. Avoid unhygienic food, avoid raw and undercooked food. On the other hand, irritable bowel syndrome can be triggered by sometimes even infections or spicy food, junk food, cold drinks, and even the stresses. Irregular physical activity or daily routine can also trigger irritable bowel syndrome. So when you are irritable bowel syndrome, then do consult your child specialist or pediatric gastroenterologist. Knowing what food items or what daily routine triggers irritable bowel syndrome can help us to treat and manage irritable bowel syndrome. If you like my video or this information, don't forget to like it, subscribe my channel. Do forward it to the parents who find this information useful. Thank you.